Hi there, and welcome to a hopefully quite a short parent information session around oral health. What I've tried to do is try to structure the session into ages and stages. So, because it's a recording on YouTube, what you can do is you can obviously just skip to the bits that you need. So it's broken up into babies, children, and then teens. And today's session really is around giving you up-to-date oral health information to support your family and sort of how to move that forward at home. The objectives all sounds very formal, is really for you to understand the importance of oral health and the link to overall health, to know those key preventative measures to include in your at-home routine, so what you should be doing at home. And then if you need emergency NHS treatment or you need to go to a dentist, some information around that as well. So just wanted to start off with some really basic facts around children's teeth. Obviously, we know that all children have teeth, and by the age of 3, most of them have got their 20 primary teeth. They're the ones that are going to fall out. So because they're designed to fall out, they are quite soft, so they do get damaged quite easily. And they can get damaged by tooth decay. And yes, it is a disease. It's the most common disease affecting children. And it's the most common reason why children end up in hospital as well. What's good to know, though, is it's completely preventable. It's 99.9% preventable. So we have all the tools, all the knowledge to avoid having this disease and to avoid our children suffering with this disease. So we have those tools, and that's what we're going to talk about, those preventative things that we can do to avoid it. In Oxfordshire, just over half of the children saw a dentist from June 21 to June 22, and the lowest numbers were in that 0 to 5 age range. Now, obviously, there's lots of barriers around going to the dentist. We're just moving out of a pandemic, so there has been a knock-on effect on how easy it is to see the dentist, and also the numbers of dentists that are taking on NHS patients. So we know that's a problem. We know that more children need to go to the dentist who aren't going to dentists, but what can we be doing at home to mean that we don't need to go to the dentist? It's nice to go to the dentist, to get used to the dentist, to see a dentist, and it being a nice positive experience. But if we can't get to a dentist, what can we do to prevent the need finding one in an emergency? And then this, obviously, you will all know this, but teeth are made out of enamel, and this is the hardest substance in your body. In fact, it's twice as hard as bone. However, unlike bone, it can't heal itself. So it's one of the only things in parts of your body which won't heal itself. So once you've got damage to teeth, baby teeth, adult teeth, it won't heal itself, and that's why you end up needing a dentist to solve it. So to avoid that, what can we do at home? And why is it important? So we know that a healthy mouth is needed for lots and lots of things. There's a few things here: smiling, speaking, breathing, learning, eating, feeling confident, making that good first impression. We know that a good, healthy smile does a lot to get you a job. Obviously, our children are not there yet, but we want them to have a nice, healthy habits now, so that when they're old enough, they do feel confident. They can, smile and laugh without having to cover their mouths and things like that. And obviously, it's crucial for lots more things, but those are the key sort of things. And one thing to remember is the mouth is the gateway to the health of the rest of the body. If you think about it, your mouth is involved in literally everything you do, but obviously what we put in there affects the health of the rest of our body. And obviously, really, in terms of teeth, we're thinking about food. Now, children can experience poor oral health, and that's on a spectrum. So it could be just the starting of very mild gum disease. It could be rampant tooth decay. So there is a range here. But if you've got poor oral health, children can experience the following sort of issues around that. They could be in some pain, some discomfort, could affect their sleep, which we know affects how well they learn, so have a bigger knock-on effect. They could need antibacterial, or they could need antibiotics for infections and swelling, so medication, which isn't great. If they have got issues inside the mouth, it could limit how they speak and how they eat, which obviously isn't good for their growth and development and their learning. Their confidence, their mental health. Lots of people will cover up their mouth when they know what I do for a living, because they're embarrassed of what's going on. We don't want our children to grow up with those issues. There's no need for it. As we know, it's 99.9% preventable. Time off school and time off work, huge impact there on learning and also your own economic situation. You know, if you have to take time off work and it's unpaid, that's not great. And then ultimately treatment under general anaesthetic. We know that not many dentists want to take out teeth in the dentist chair. It's just not a viable situation, especially with small children. So they end up being referred into hospital. And all of this can then create a very negative association with what's going on in the mouth, going to the dentist, brushing, etc. And then you've got this catch-22 situation where children don't want to do these routines because they've had these bad experiences. But actually, we want to avoid getting here if possible. So how do we end up with gum disease, tooth decay, and other oral health issues? Well, it's multifaceted. There's lots of reasons why, but here are some of the basics. A sugary diet is a huge part of it. Like I said, what you put in your mouth really does impact what's going on here. And so what you're putting in your baby's bottles, what snacks you're giving them, what drinks you're giving them will have an impact on the teeth and overall their overall health, and obviously weight and things like that as well. Medication, so if your child's on lots of medication and it's liquid medication, it's got sugar in it, that will have an impact. Not going to the dentist, obviously, like we've said, we can do a lot to avoid the dentist, but if you've got a problem and you're not going, that's going to be a problem. Ineffective brushing, nice picture of some brushes there, one's suitable, one isn't. And, you know, just not watching your children brush, not knowing whether they've done a good enough job or not. That's all part of, you know, not doing a good enough job and leaving lots of bacteria there. And then for older children and teenagers, it's those lifestyle choices. It's vaping, smoking, alcohol can have a huge impact on what's happening inside the mouth. So I have broken up, like I said at the very beginning, into ages and stages because each of those sections have different recommendations. So please do skip to the bit that's relevant to you. And in each section, I'm going to talk about key brushing advice, key diet advice, and then we're going to talk about the dentist as well. Some of it is similar and it does overlap, but lots of it is very specific to those different age ranges. So let's start with babies, our 0 to 2-year-olds. So a very simple routine at home will prevent gum disease and tooth decay, like I said. So we want to start brushing baby's teeth from the moment they erupt. So I've just circled there in the photo, a very, you know, that's a very top of a tooth, a little white line. This is when you start brushing. Don't leave it till they've got all their teeth. That's too late. Brushing as soon as they've got their first tooth. The reason being, that first tooth is very soft. It needs the fluoride and it needs to be cleaned. It will be impacted by the weaning stage, which is around about the same time that those teeth come through. So it's really, really important. And it's important for the baby to get used to brushing twice a day, every day, and then it becomes part of their habit and their routine. We want to use a smear of baby toothpaste on a baby brush. Okay, so a nice soft baby brush with a smear of toothpaste. It can be a family toothpaste or a children's toothpaste, but it must contain at least 1,000 parts per million of fluoride. Sometimes labeled on the front of the packet, if not, always on the back of the tube in the ingredients. So you're looking for at least 1,000. More is fine, but it has to be at least 1,000. And it has to stick with that smear because they're going to swallow it. They're not learnt to spit out at this 0 to 2 age. They're going to swallow it. We are talking about brushing twice a day. Seems like, oh my goodness, another thing to fit into the routine. But like I said, if you start this early and baby gets used to it and you're using a mild mint toothpaste, there is no transition to a different toothpaste. There is no, oh, we've suddenly got to do it another time. You've done it from twice a day from the moment they've got their teeth. So it becomes normal. And it's most important at bedtime. So that bedtime brush is the key to really keeping those teeth healthy. And then one other time during the day. Anytime during the day. It can be first thing if that fits into your routine. If it doesn't fit into yours or your baby's routine, do it at another time, anytime during the day. But that second brush is also vital. Thinking about the bedtime routine, don't give any drink after brushing. So brush the baby's teeth. They don't need to swish or swill. They don't need a drink of water. Brush your baby's teeth. Leave leave them for about half an hour until you give them anything to drink or anything to eat. That will allow the fluoride to do its thing. And really, from the age of 1, babies shouldn't need to be using a bottle full of milk at bedtime. Transition to a free flow cup because they may not need those extra calories. If you want to talk about how much milk your baby's consuming, then please do talk to your health visitor for advice. But really, you know, they shouldn't need that extra sort of hit of milk just before bed after the age of 1. But it differs for every child, so do talk to your health visitor. The other thing that I'll just say here is if you're breastfeeding past 1, then you don't need to worry about it. That will not impact the teeth because the mechanics of it, where the milk is hitting inside the mouth, is very different. So continue breastfeeding if you're breastfeeding, and consider sort of moving on to a free flow cup for children who are a little bit older and are using formula. If you're using a dummy, only use it for pacifying. Pacifying just means helping them calm down. And if you're using it to go to sleep, use it consistently. So if you're using it at nap time, use it at every nap time. If you're using it at bedtime, use it every bedtime. Try and give this up around 6 to 18 months. So there's a broad spectrum. Around about 6 months is when the sucking reflex stops, so you can sort of start to take it away from the baby, but really no longer than 18 months. And it's because it can affect babbling and talking and sounds and all those sort of kinds of things. So we don't want it to be used as a plug. Use it for the purpose it was designed for, which is to calm the baby down, and then, you know, they don't need it any longer. So they don't need it in all the time. Just like the little baby in the picture here, that is a very small baby using a free flow open top cup. So you can start doing that from around 6 months. So when you're weaning in the high chair, give them an open top cup with a small amount of water. They'll get used to being able to drink, not sip or suck, actually drinking. And that's a really good idea. Try and avoid your baby sucking on food for long periods of time. So any food, whether it be a fruit or a biscuit or anything like that. We don't want things in contact with teeth for a long period of time. There are those little nets that you can get that you put food in that they chew on. That's fine if you want to avoid some choking, but don't use that as something that is sucking on for a long period of time, because obviously the damage to the teeth can happen quite quickly. Weaning is to start at 6 months old or slightly later when your baby is ready. So don't feel the pressure that they have to start. As soon as the day that they're 6 months old, they have to start weaning. They don't. The Health Visitor new website has got some really good advice on introducing solid foods. And about vegetables, you know, those savoury things being the first sort of things that you introduce. And I can't stress this enough. Try and avoid processed baby toddler snacks because they're often full of hidden sugars that you don't really realise. And also they don't have the same packaging as other food either. I know it's convenient, it's quick and easy, but there are lots of quick and easy non-baby foods that actually have less sugar in that you could give to your baby, like things like Weetabix or plain rice cakes or plain breadsticks, not actually baby ones, actually get you more for your money. So have a think about that. And if possible, stick to real unprocessed foods. And talking about real unprocessed foods, there are some snacks here. Some of them are aimed at babies specifically, and some are aimed to sort of slightly moving on past that sort of early weaning phase. But we're kind of obsessed with like snacks, that children need snacks all the time. They don't need to be grazing all the time. They can have a mid-morning snack, but it would be better, as I'll show you in a second, if it was real fruit or vegetables. So here are some of these snacks that you'll probably see on the supermarket shelf. If you're used to sort of packing lunch boxes or buying baby snacks, you'll probably be familiar with some of these. Now, to be classed as a low sugar snack, which would be fine for the teeth, and obviously not giving your children too much sugar, which can obviously lead to weight gain, it should be 5 grams or less per 100 grams. Okay, so when you look on the back of the packet, so it's not per packet, it's not per portion, it's always per 100 grams, and it should be 5 grams or less of sugar. Okay, and that will come under the carbohydrate. You see carbohydrate, of which are sugars, and that should be 5 grams or less. So how do these ones stack up? Are they low sugar or are they not? Well, crispy tiddlers, definitely not low sugar. They are 63 grams, so that's 63% pure sugar, so way over, very high. The organics bars, 55 grams of sugar per 100 grams. The yo-yos, so that's half of them are just pure sugar, so equivalent to things like Haribo sweets. The Humzingers, 53 grams. The Rice Krispie bars, 29 grams. So they're all high sugar so far. We've got the banana biscotti, and you may say, oh, that's okay, that one's medium, that's much better. But what's worrying about the banana biscotti is they're aimed at 7-month-old babies, so very young babies, and these have more sugar per biscuit than a plain rich tea, which again are much cheaper. And so think about what you're giving to your children, because as soon as they get that sweet taste early on, that's all they want. What's it? You may think, oh, they're a nice savoury snack. Not actually low sugar. They're not far off it, but they're not actually low sugar. And then these barbecue Gruffalo claws, which again sound very savoury. Again, not technically low sugar. They're much lower, but they're not low sugar. What you should be thinking about is what fresh things can I get in? Now, we do know that the fresh food at the moment per calorie is 3 times more expensive than the other things, but they do go further, and you can prep them, put them into little boxes, put them in the fridge, get them out when you need them. So you could do a whole day's prep of a snack, and some for later perhaps as well. And be safe in the knowledge that these will fill your babies up better, they're better for their teeth, and they're better for their whole body. Now, have you heard about the Healthy Start scheme? This has been going for a long time now, but it has recently been revamped, and it is now all online. So you go to the website, you apply online, they check if you are eligible. So are you in a low-income family? Are you in receipt of certain benefits? If you are, and you're pregnant, or you have children that are under the age of 4, then you can get help to buy food and milk. And it's very specific about what you should be spending this extra money on. Fresh fruit and vegetables, some canned, some frozen, plain cow's milk, some formulas, and then you get free vitamins. You don't have to buy the vitamins, you get those free. And you get a little card, MasterCard, that you can use contactless. So it's a much simpler process, but there are people out there who don't know they're eligible and are missing out on this extra bit of money. So if you think you might be eligible, you can have a look at our video online and you can check your eligibility, or you can go to Healthy Start online and check there. Other things that is important for babies, I've said already, obviously we want them to go to the dentist. It'd be great if every baby was going before they were 1 year old to get their very first checkup. That is the campaign that's been running for a number of years now, Dental Check by One. That would be great. If you're having problems doing that, then don't worry about it too much. Hopefully going forward, we will get more NHS availability. And if you are already registered, that's fine. Call your dentist, see if you can get back into those regular appointments. It is free on the NHS until your child is 18. If you haven't got a dentist, or you're not sure whether you're registered anymore, call 111, give them your postcode. They will try and help you with finding somewhere there, or alternatively, you could use the website. If you have concerns about your child's teeth or about your teeth, call 111. They will triage you. They will find out if it's an emergency, and if it is deemed as an emergency and you need dental care, they will find you somewhere that's got an emergency appointment, or they will send you to out of hours, which in Oxfordshire is run by Oxford Health. The other thing to note is all dental practices that have some NHS work that they do will also have emergency appointments, just a bit like at the GPs. You will need to call them very early in the morning and see if you can access that. So that is a possibility. If you need an emergency appointment, you can call a local dentist. Doesn't have to be the one that you're registered with or the one the closest to you, just one that you can access. Okay, so that's finished now with babies. Obviously, if you've got questions, our website has lots of the similar things that I've just talked about as well, in some leaflet form, so you can head there if you want some extra information. So moving on to children who are 3 to 11. Again, that simple routine is really, really important. We want to be able to prevent tooth decay and gum disease. Same for them. These 3-year-olds should be brushing twice a day for 2 minutes, bedtime, and daytime. Same rule applies. Bedtime is most important. Any time during the day. It can be first thing in the morning, but if they're going to nursery, or if they're going anywhere in the morning, or if you're going out with other older children and you want them to brush first thing, that's fine. But if it doesn't work, you can do any time during the day. I've just highlighted here with some pictures some things that might help you to engage your child in brushing, because as they get to this sort of toddler stage, clamping their mouth shut and refusing to do their teeth is one way that they can exert a little bit of control. So just gentle encouragement using things like the Brush DJ app. Do they love music? Chompers are little stories. Colgate have got 2-minute tales, which are on you can use on your iPad. Aquafresh have got the app called Brush Time. Disney, Magic with Oral-B, and then things like Tooth Saver. So there are lots of things out there. If you want a distraction and you're happy to use a screen, then there are lots of things out there. Otherwise, try and make it as fun as possible, and try and demonstrate that you're doing the same thing, that older brothers and sisters are doing the same thing, and just keep going. It is something that you have to do over and over again, and about 15 times, so 2 weeks of doing it over and over again, it will become a habit. So building it into their routine as soon as possible is a great idea. And the other thing to note is like your routine, when to do it. So first thing in the morning can often be quite stressful, quite busy. So as soon as your children get up, they usually pop to the bathroom, spend a penny, go and brush your teeth at the same time. So go to the toilet, brush your teeth, and then it's done. And also you don't have to nag them to get back upstairs to brush those teeth. You don't have to go with them to supervise it. You can all just get up, go to the bathroom and do it first thing. It works for some people, not for others. But obviously you could be brushing in the kitchen. There's nothing to say that you can't brush your teeth at the kitchen sink. So instead of nagging children to go back upstairs, you're busy still doing things in the kitchen perhaps, and you can supervise and get them brushing in the kitchen. Nothing wrong with that. So where you do it is completely up to you, but try and get it into your routine. Last thing before bed and at a time during the day. We know that brushing before bedtime is crucial, same for babies, same for children, same for adults. So last thing before bed, and try, where possible, to allow your child not to have any food or any drink in the last hour before they go to bed. So nothing really should be eaten or drunk in the last hour before bed, and then just before they go to bed, brush their teeth. That really will help to protect their teeth from sugar and acid. So children do benefit from extra fluoride. Okay, so these children who are 3 to 11, 3-year-olds up to the age of 7 need at least 1,000 parts per million. Once they're 7, they hit an extra amount, and they should be having 1350 to 1450. So that is a older child's toothpaste or a family toothpaste. Okay, and from 3, as long as they can spit out the bubbles, they can have a pea-sized amount. So we're talking the end of your little finger. So it's not a Aquafresh swish. It's a small little pea-sized amount, same as you can see on the brush here. And this is a children's brush, so it's a small pea-sized amount. Obviously, the more amount of fluoride, the more protection you're getting. So even if your child can't spit out, they can use that higher amount of fluoride. Okay, if you think your child is around about 3 and still can't reliably spit out, just stick with a smear until they can reliably spit out, and then you can graduate to that pea-sized amount. Always use a fluoride toothpaste. That's really important. I've highlighted here Sainsbury's own, and this is 44p. Other supermarkets like Morrison's and Tesco's, they do ones that are just the same. They're a basic toothpaste, ranging from 30 to 50p. They're just as effective as buying something like Colgate or Aquafresh. They have the same amount of fluoride as the only active ingredient your children need in their toothpaste. And think about it. You could spend 44p on Sainsbury's toothpaste. Your baby uses a smear. Your toddler's using a pea-sized amount. You and any other adults living in the house can use a pea-sized amount. One toothpaste for everybody, and it costs 44p. So saving you money there, okay? What I would say is that children do need help and support to brush their teeth, and we kind of say up to the ages of 5 or 6, a parent or guardian or older sibling, if they're capable, should be brushing their teeth for them until they hit 5 or 6 years old. Please allow them and encourage them to have a go and keep it fun, but the majority of the brushing should be done by an adult, just because they don't have enough manual dexterity to get in all those nooks and crannies. And then up until 8 years old, they should have close supervision. So that means you as an adult watching your child brush their teeth. Are they getting to the back? Are they getting in the gum line? Are they getting on all the teeth? Are they using the right amount of toothpaste? Are they spitting out after? Are they not rinsing? We don't want them to rinse. We want them to spit and don't rinse. Think about this lovely llama picture here. We want them to spit out and then not rinse. Don't rinse with water. Don't rinse with mouthwash. Okay. And then your brush is key. Is it in good enough condition that it's going to be removing the bacteria enough? If your brush looks like the one on the left here and it's a little bit splayed, it won't be doing a good clean, and it could actually damage your children's gums and then your own if your brush looks like that as well. And it'll hold on to more bacteria because it's older and the bristles start to get a little bit damaged. Okay, so nice toothbrush with nice straight bristles will do a much better job at cleaning. We've said already, spit, don't rinse, no water, no mouthwash. The only time a child would have mouthwash is if a dentist has recommended it. All the other ones on the supermarket shelf, even though they might say for the ages 6+ or 8+, they are what we call a cosmetic. So they're not an essential. The essential is a toothbrush and fluoride toothpaste. All the other things are sort of added extras, okay? When you hit a certain age, incidental cleaning becomes an essential, but mouthwash is not an essential for anybody, and you do get charged VAT on it. And if you're using it directly after brushing, you're washing off the fluoride before it can be absorbed into the enamel and strengthen it up. Remember, enamel can't heal itself, so it needs all the protection it can get. And if you're rinsing off your toothpaste, you're not allowing it to be protected. I want you to have a quick look at these toothpastes here. I've given you a sort of a range of different ones. Have a quick look. Which ones do you think would be suitable? What have I mentioned already around amounts of fluoride, and what would be suitable? So the ones with smiley faces are absolutely suitable. The ones with crosses on are not. So let's look at those first. So we've got one here, Kingfisher, no fluoride. Not good enough. We want the fluoride in there to protect our teeth. Now, children up until the age of 11 will have some of their baby teeth, their primary teeth, the ones that are going to fall out. And they shouldn't have any whitening. So no charcoal toothpaste, no advanced whitening, nothing with any abrasion in it, because that will do more damage to their teeth. So no whitening, and also no sensitive. Sensitive toothpaste has got added ingredients that are not suitable for children. Okay, so just don't go there. You may, from about the age of 6, if a dentist recommends it, or your child has got sensitivity, not tooth pain from anything else, but sensitivity, from something like hot and cold, then they might, from the age of 6, have something like the children's version of the Pronamel, and that might help with that. But otherwise, it would be on a recommendation from a dentist, and probably not until they've got all their adult teeth. The ones that got smiley faces are pretty obvious. We've talked about the Sainsbury's Basic one already. We've got the Colgate Total there. As you can see, they've got exactly the same amounts of fluoride, but are very different in cost. We have got over here Tesco's Strawberry. So I'm just highlighting here that if you are having a child who really doesn't like mint and you're trying a fruit flavour, that's fine. I wouldn't start out with the fruit flavours from the beginning, because it's very hard then to transition onto mint. Okay, so try mint first of all. And the supermarket own ones, I'm going to say it again, are really good for this, because they're basically like a children's toothpaste. They're very mild mint, because mint doesn't do very much. So you could try them on that. If you have to use a fruit one, try and look for one that's got the same amount of fluoride in. So this lovely Tesco's one's got 1450, which is perfect. And then up here in the top right hand corner is a toothpaste you may not have heard of, not in the supermarket. It's unflavoured and it's no foaming. So this was designed for children with autism, but it's being used widely by a number of people, and a number of people who maybe don't like flavour of toothpaste, don't like the foaming sensation. This one is suitable. So you can get it in your pharmacy, get it online, or your dentist can prescribe it as well. So how tooth decay happens and sugar acid attack. I just wanted to touch on here, because obviously we've got to the age now, 3 to 11, where children can start to understand what's going on inside my mouth. What do I need to do? This book here, Open Wide What's Inside, is going to highlight what I'm going to talk about now. In a very lovely visual way. And if you haven't got time or money to buy a book, don't worry. My lovely colleague Sophie reads it on our YouTube channel, so they can You can watch it as many times as you like. And it's a really, really great story for children 3+. So how are we ending up with holes in the teeth? So we have got a horrible image here of some children's teeth with holes in. That's dental decay. Remember, it's a disease, one that we can avoid. How do we get from just our teeth to holes in the teeth? So in the image on the left-hand side, you can see here a nice set of teeth, and that highlighted along the gum line is some bacteria, some plaque, dental plaque. That is a sticky biofilm and will only ever be yellow if it's more than 12 hours old. So if your children have said they've brushed their teeth and then they're smiling and talking to you and you can see a yellow line along the gum line, they've not done a good enough job. They either haven't brushed or they've missed it completely. Like I said, haven't got the manual dexterity until around 7 or 8 to really get in to that gum line and brush those bugs away. So bacteria doesn't normally look like this. If you've brushed your teeth this morning, there should be no yellow line. The bacteria is normally the same colour as your teeth, which can make it tricky to know whether you've removed it or not. But if it is yellow and you've got yellow build-up, that's bacteria that hasn't been brushed off and needs addressing quite quickly. That bacteria, if left on the teeth, as you can see in this image, can start to make the gum a little bit angry. So turns a bit red, a bit sore, a bit puffy, and then the next thing you know, you might get some blood on your toothbrush or you're spitting out blood after brushing. That's a sign of gum disease, and children can succumb to that quite quickly, a matter of days of not brushing effectively with bacteria sitting in the gum line. A few days later, they can be spitting out blood, which can lead to all manner of problems. So we don't want to get to that stage. So looking in the mirror while you're brushing, making sure your brush is angled into that gum line, really getting in there, using circles if you can. If you're using electric toothbrush, that can be doing it for you. Little tiny children might not want to be using an electric toothbrush, so we're going to go for circles if you're brushing. If a child is brushing and they can't do circles, they want to have a go up and down, back to front, is absolutely fine, as long as you are looking and brushing every surface of every tooth inside the mouth. Okay, that's the real key, getting in that gum line, removing the bacteria, every surface of every tooth, because you will be applying some of that fluoride to protect the enamel, which, remember, doesn't heal by itself, has to have that fluoride to protect it. So how do we go from that to holes in the teeth? So every time you eat something, it usually contains sugar. Okay, sugar that the bacteria can access. So things like your breakfast cereal, any dried fruit, cans of Coke, baked beans, bread. The list is endless. Okay, so wherever the bacteria can access sugar, it will eat that sugar and then it will excrete or poo out acid onto your tooth enamel. Now, acid, as you know, will start to dissolve things and will start to make things weak, and it's the same with your enamel. It's not going to happen once or twice after eating, but a build-up of these sugar acid attacks will cause lesions and then small holes to form in the teeth, and that's when you end up with tooth decay. Now, for teeth, it's not how much sugar that your child might be having, it is how often. Okay, so even if they're just having one chewy sweet at 11 o'clock in the morning, they will have a sugar acid attack and there will be acid on the teeth for about an hour. Okay, until the saliva can mineralize it and neutralize it and get it back to normal, it will be acidic for about an hour. Even if they're just having one sip of Coke, sort of every half an hour or something, every time they sip that Coke, they'll have a sugar acid attack. So the higher the frequency, the more likely you are to get tooth decay. And remember, children's teeth are softer, they will get impacted by tooth decay quicker than adults. So what we want to do is reduce the frequency. Okay, so really think about your snacks. Okay, think about, am I making sure that the snacks in between meals are low sugar or sugar free? Children aged sort of 2 to 11 and 3 to 11, I've included here a slide that shows you amounts of sugar. Now, it's a lot of numbers, and it's about added sugar or free sugars, and you might be thinking, well, what is that? Is that sugar that you've put on things, white sugar? No, it's all sugars that are contained in any processed foods. So remember, Trying to avoid as many processed foods as possible would be really good. But what does it mean? What is added sugar? What is free sugar? So I'm going to reverse that question and tell you what it's not. What things can you eat, can your children eat, where you don't need to worry about how much sugar is in them? There's only 5 things that you don't need to worry about. So it's quite simple. You don't need to worry about the fructose in fruit, the fructose in vegetables. The sugar in those 2 things, fresh fruit and vegetables, don't need to worry about. In plain milk and plain yogurt and plain cheese, plain being the operative word here, if they're all plain, they do contain some lactose, but again, you don't need to worry about them. So 5 things, and you can add water into there as well. You don't need to worry about that. So fresh vegetables, fresh fruit, plain yogurt, plain milk, plain cheese. They do all contain sugar, but not in the way that they are in like processed foods. So now imagine your shopping basket or shopping trolley and think about, oh, what else was in there other than fresh fruit, fresh vegetables, plain yogurt, plain milk, plain cheese? All those other things will contain sugar to a degree. And yes, it is a complicated thing to be like adding up all the sugar that your child's eaten. I'm not going to ask you to do that because that's just not practical. But thinking about, do they really need a sugary cereal, or is there one that I could buy that has got less sugar in? Because I know that they have cereal for breakfast. Is there a snack I can give them that is low sugar or sugar free? So fresh fruit and vegetables, plain crackers, cheese, things like that. So where you can think about, can I reduce the sugar? Is there an alternative that has got less sugar or no added sugar? And that way you can be making those swaps. Now, I'm sure you've all heard of the food scanner. It can be hard sometimes to think about what swaps can I make, what would be useful. It is a free app that you can download. You can scan the food you already have at home or foods in the supermarket, and it will tell you whether they are high, medium or low sugar and fat and salt as well. And it will give you an alternative to try. Okay, so let's, for example, say that you put in cakes into your child's lunchbox, Mr. Kipling, for example, little cakes. What could you swap there? There's a lot of sugar in one of those tiny little cakes, and they're not very filling, bad for your teeth, and a big hit of sugar. What could you put in instead? So they might suggest something like malt loaf. The child will still be thinking, oh, I'm having a little cake, but the amount of sugar is drastically reduced and things like that. So it does give you alternatives. So here we've mentioned all these things already. These things would be fine as a snack, and there are lots and lots of other things that you could choose from. I haven't got nuts and seeds on here. I haven't got hummus on here. Things like pita breads and things like that would be absolutely fine. If your child's old enough, plain popcorn, make your own popcorn. They love that, and it's really cheap to buy a pack of corn. Don't buy the stuff that's already been pre-popped. Buy a pack of corn, takes less than 5 minutes, pop it in a saucepan or in a microwave, and you've got a lovely bowl of warm popcorn. They do need to be old enough though that they are able to swallow that. So definitely sort of 4 or 5 plus. So all these things would be absolutely fine. These things would be not great. They wouldn't be friendly to your teeth or your children's teeth if they're having these in between. So we're not saying don't ever eat these things, don't ever eat things with sugar in anymore, because that's not realistic. But where possible, make them part of the meal and keep them to a small portion. A portion size is anyone's palm, okay? So your hand here. So if you've got a small child, their portion will fit inside their palm. And if you're feeding an adult, their portion will fit inside their palm. So try and keep the amounts of sugary things that you give to children small to their age. And where possible, make it part of a meal. So if the child likes raisins, put them on their cereal or put them with their breakfast. If they like a sugary yogurt, a petit filet or something like that, have it as your pudding. If they like jam on toast, just have one slice and have it as a breakfast, but not something in between. And drinks are an easy thing to cut out because you're having food that's sugary. So you don't need a sugary drink as well. And these don't offer very much other than lots of extra sugar. If you're going to give them, like I've already said, try and give them to a mealtime and keep the portions small, okay? Small tweaks to the diet will help to minimize damage to the teeth. So we are really focusing on teeth here. Drink water. You've already paid for the water that's coming out of your tap. So it's free in inverted commas and it's completely tooth friendly. So plenty of water keeps you hydrated as well. It's good for the brain. Unsweetened milk or milk alternatives, make sure they're unsweetened. That's fine. Fresh fruit and vegetables. We know they are more expensive, but look for places that have really great offers. We know that Lidl and Aldi have all those weekly offers where everything is like really, have their top 5 that are really cheap. Go for the things that your children like there, or try something new. If you're going to give other snacks, keep them small and plain. And if you're feeding a baby on snacks, remember those processed ones can be very high in sugar. There can be other alternatives like breadsticks and rice cakes that are just normal versions that are much lower in sugar. So beware there. Juices, squash and smoothies, children don't really need them. They're just extra sugar, which you don't need. But if you're going to give them a small portion with a meal. Sugary snacks and drinks, try and keep them small and with a meal only. So if you are going to give something sweet in a lunchbox, do they need it every day? Or could they just have a cake on a Friday in their lunchbox? Sweeties and chocolate and things like that. Try and stick to a sweetie day where you only have it once and you have it's your pudding after your meal. So then really look forward to that. It won't become something that's boring, or we have sweets every day. That's not very exciting. It will become exciting again. And if in doubt, use your food scanner, okay? Would you give cookies for breakfast? I'm sure you wouldn't. 3 cookies normally is around about 9 grams of added sugar. So where do these cereals stack up? So remember I just said swapping. If you're already eating cereals, is there a cereal that you could choose that's lower? Cocoa Wheats, very close to having 3 cookies. Now, bear in mind as well, I've done this all on the portion of cereals. Like each cereal packet will have a recommended portion size. Some will be bigger than others. These cocoa wheats, you're only supposed to have 30 grams. You've probably never weighed out your cereal, but 30 grams will literally fit in your palm as an adult. Okay, so it's a very small amount. So if you're having double that, imagine you're having double the sugar. So you're almost like having 6 cookies for breakfast or even more. Good old Frosties coming in at 11 grams per 30 grams bowl. Ask your children this if they like Frosties. What's wrong with Tony the Tiger? Where are his teeth? He's a tiger, isn't he? Why hasn't he got teeth? I think he's been eating too many Frosties. So much higher. Even a raisin granola, which looks and sounds healthier, 10 grams per 30 gram portion. So a third of it is sugar, whereas good old shredded wheat is coming in green. There are lots of things you can do to spice up your shredded wheat. Okay, if you wanted to, you could put, if you really need a hit of sweet, you could put a teaspoon of honey on there. You can add some chopped fruit, a banana, some blueberries, things like that. That'll make it seem, and obviously you'll be getting a portion of fruit in there, which is fantastic. Rice pops, again, I've got Sainsbury's own there coming in at 2.4 grams, so much less, nice and low. And then good old staple porridge, and this is the convenient porridge as well. It's not the one that you've got to make from scratch. Nice convenient porridge. You can do it in the microwave. Look, 0.3 grams per bowl of porridge, and that is a slow release. So anything that's whole wheat, like your shredded wheat or your porridge, is going to make your child feel fuller for longer. Okay, and they won't be pestering you at 10 o'clock in the morning saying I need a snack, because it will feel full. What's a really great addition to breakfast? Some fruit. A whole piece of fruit. That will be one of their 5 a day that they're having at breakfast. They can have another one at lunchtime, another one at tea time. Add in some vegetables. You'll very quickly get to your 5 a day. So I just want you to have a quick think about things that you might be putting in your lunchbox and sending to school. These 4 items were in one lunchbox for a 3-year-old in a survey that I did a little while ago, along with a sandwich and a packet of crisps. But little did the parents know that this child was consuming a heck of a lot of added sugar, because as you can see, all 4 of these items, some of them are fruit-based, are all processed, which means that they all contain added or free sugars, okay, which are not good for our children. So we are living, there's lots of food out, different choices out there, and it's so hard, isn't it, to see the wood for the trees. So where possible, try and give your children no processed foods, okay? So fresh, think fresh. It is a bit more expensive, so think about how you can make it go a longer way. This Petit Filou yogurt is coming in at 8 grams. We've got the Innocent Smoothie coming in at 15 for that children's size packet there. The yogurt raisins coming in at 16 grams, and the Bear Now, obviously, all the numbers that I showed you earlier, you've probably forgotten already. But if this was a 3-year-old child, they should be having no more than 16 grams of sugar in a whole day, not just their lunch, in a whole day. So just eating these juicy yogurt raisins, they've eaten their whole daily allowance in one packet of raisins. Now, for the rest of the day, they can eat fresh fruit and fresh vegetables, plain milk, plain yogurt, and plain cheese, which obviously is not realistic. So it's very easy to go over. So in an ideal world, in this lunchbox, if this was my child's lunchbox, I'd scrap all of those and I'd maybe put in, if they needed something sweet and I wanted them to have, I don't know, a biscuit, go for a rich tea biscuit, a couple of fingers, they'll think they're having a biscuit, a sandwich, maybe some chopped up vegetables. That's enough. We're also giving our children a lot of calories in their lunchtime and they don't need it. So where possible, try and give all the food groups. So protein, carbohydrate, lots of vegetables, lots of fruit, and a little bit of dairy. Try and stick to that palm child-sized portions. They don't need any more. Try and go with a minimally processed or unprocessed food. Try and serve fresh fruit and vegetables with every meal. And then you'll be getting in that 5 a day quite easily. Try and avoid anything that's ultra processed. And you might think, well, what is ultra processed? If you look on the packet before you buy it, if in the ingredients there are more than 5 ingredients, then it's going to be highly processed or ultra processed. And where possible, limit sugary foods and snacks. Try and think of it as a treat, okay? It's something special that they can have once or twice a week. So we're not saying don't ever have it again, but really limit it so it becomes special to a child. It's not an everyday thing, and they get to choose maybe one thing out of a tin or out of a packet, something like that. Going to the dentist. Obviously, we want them, just like the babies, to be going to these preventative appointments until they're 18 in an ideal world. At 3, they should be having fluoride varnish applied to their teeth every time they go. If your dentist doesn't get out the little pot and brush and say, oh, I'm going to paint this onto your teeth, do you like banana flavour? Please ask your dentist. They should really be doing it. We know it's a proven preventative measure. Every dentist should be doing this from the age of 3 every time you take your child to the dentist. Just like I reiterated earlier, you can get an NHS dentist by calling 111 or looking on the website. And I will reiterate, if you have an emergency, get yourself triaged by 111. They should be able to help you and help you find an emergency appointment if needed, or call your local dentist and see if you can access one of their appointments. Okay, so we're going to move on now to the teens section. Okay, it's the same sort of thing. Okay, so teens from about 12, for some reason, they'll go one of 2 ways. They'll either be very concerned about maybe what they look like or how bad their breath might be, and they will really do their teeth no problem. Then you've got the other ones who just can't be bothered. It's just your teeth, it's fine, no one cares. Obviously, that can then lead into some quite tricky issues. So again, that simple twice daily routine of brushing with a fluoride toothpaste will avoid bad breath, tooth decay, gum disease, stained teeth, and dental erosion. We know that more and more teenagers are drinking sugary or acidic drinks, eating more sugary foods, lots of them having way more sugar than they need to, okay, because it's easy and convenient. It's much better for our teens to be taught that they want to be confident. We want them to have good mental health, and being able to smile and feel confident helps you with your friends, helps you with jobs in the future. So we want them to have that. So building in that routine and trying to stick to it's really important. So again, just like the younger children, we want them to be brushing twice a day for 2 minutes, definitely before bedtime and one other time, and using that higher fluoride toothpaste, so 1,350 plus. A family toothpaste is absolutely fine. If they want to use a sensitive one, if they've got any sensitivity, if it's really bad, they probably do need to see a dentist. If it's just mild, use a sensitive toothpaste, that should help. Whitening toothpaste is abrasive. You know, in the TikTok era of having very white teeth, some of those teeth won't be real, they won't be actual teeth. So whitening toothpaste doesn't always do the job that people are expecting it to, and can actually do a bit of damage. So they're not too bothered about whitening. Just carry on with that, they don't need it. And at this age, really at 12, just like the boy in the picture there, flossing or using interdental brushes once a day will help avoid gum disease, which affects almost half adults in the UK at any one time. And that would be painful gums, pink, red, blood on brushing, sometimes blood on eating. If you're getting blood on eating, that's really quite bad. If you leave it and do nothing, it could progress to periodontitis, and then you could have problems with tooth becoming loose and things like that. We want to avoid that. And the best way to avoid gum disease is to brush twice a day. It's very simple. It's nothing extra. Doing those interdental brushes will disturb bacteria in between your teeth that your brush can't reach. So it's a good idea, and you can do it any time of the day. It doesn't matter. Again, spit, don't rinse. Don't rinse off that lovely fluoride. Keep it on your teeth for at least half an hour. Same as all the other ages. Keep that brush nice condition, and then it will do a good job at keeping your teeth clean. Now, if you want to use a mouthwash, like I said, it's not really important for anybody really, unless you're suffering with gum disease, in which case, yes, go ahead and use a mouthwash, but please use it at a different time to brushing. Okay. And a really good one to recommend to teenagers is sugar-free gum. Okay, most chewing gum nowadays is sugar-free. It's a really good one after a meal. It stimulates your saliva, gets your mouth back to normal quicker than just letting your saliva do it by itself. So if they've had a meal where they've had some ice cream, sweets, whatever it is, it's pudding, if they have a sugar-free chewing gum, it will start to sort of get the mouth back to normal quickly. Now, obviously, teenagers are not far away from being fully fledged adults, okay? And they will be at risk of getting other health complications. They're not immune to it just because they're teenagers. They may feel like they are. We've talked already about gum disease, and the signs are obviously blood on brushing, swollen gums. This is going to be more likely if your child is doing lifestyle choices that involve things like vaping, smoking, drinking alcohol, taking lots of medication, or recreational or illicit drugs, okay? So all those things definitely cause issues inside the mouth, usually gum related issues. So if your child is suffering with a dry mouth or any of those sort of things that we've mentioned, and it could be a result of some of those lifestyle choices. So thinking about whether to adjust those things, or making sure that the oral health in those twice a day routines are being done. Other problems that poor oral health can lead to. We've mentioned tooth loss and gum disease and bad breath and tooth decay, but bigger health issues, mouth cancer. Now, this might sound a little bit dramatic, but teenagers are often involved more in skin-to-skin contact, thinking about oral sex. Okay, skin-to-skin contact can pass on the HPV virus. And that virus is the same virus that causes cervical cancer, which we know all our teenagers now should be having a jab in years 8 and 9. So the girls get the jab and the boys get the jab. And that's because there is a risk through oral sex of passing on that virus and then affecting the mouth. Can also affect, like we said already, the cervix in girls, but also the mouth and the penis in boys too. So that is something to really think about. Have they had their injection? And if they are, taking part in, sexual relationships, then just being aware that skin to skin contact can pass on this virus as well. So reduce the number of partners and use protection where you can. Obviously, mouth cancer isn't just from HPV. Smoking, drinking will increase your risks. And we are seeing more and more young people presenting with mouth cancer, and more young people presenting with mouth cancer that is actually linked to HPV. So that vaccination is really important, and safe sex is really important. Other issues, heart disease. We know that oral bacteria can travel to the heart, causing inflammation there. We know that if people have got diabetes, their level of bacteria in the mouth can affect their blood sugar and vice versa. And there have been links as well to oral health issues and strokes. Again, sounds like an older person's issue, but if your children as teenagers are growing up with poor oral health habits, or are doing these lifestyle choices which could impact their oral health, it won't be long and they could be suffering with other issues as well. Lung conditions, really thinking about vaping and smoking, obviously, but also aspiration pneumonia. So aspirating, breathing in the bacteria that's inside the mouth. And there's some very unhealthy gums there. So you can see the bleeding and the swelling. So diet can be a tricky one with older teenagers because they are no longer perhaps eating lots of food at home. They're probably eating and choosing their own foods when they're out and about. What are they buying? Convenience foods, sweet foods normally, unhealthy foods normally as well, even though lots of them do know what's healthy and what's not. So at home, making sure that what they have at home is going to prevent issues is really, really important. So same sort of things we talked about already. Lots of water, it's tooth friendly. Fizzy drinks can be very acidic. So if they like a fizzy drink and you're happy to give that at home, have it with a meal or use a straw. That will minimize the impact as well. And if they're drinking fizzy drinks, try and remember not in that last hour before bed, okay, because they're very acidic and usually full of sugar as well. Fresh fruit and vegetables, those are a great tooth-friendly snack. Keep other snacks as plain as possible. Popcorn, nuts, seeds, crumpets, breads, breadsticks, those kinds of things would be really great. Obviously, crisps, if they are real potatoes, so things like Walker's crisps, those are actually tooth-friendly too. But remember the fat and salt contents. That's not something that you're going to be wanting to recommend every day. Juices, squash and smoothies, try and have them with a meal only. And then any sugary snacks, it's the same thing for adults. We don't want to be eating too much sugar, so keep it small and keep it with a meal where possible. You could also, just going back here, you could also ask your teenager to download the food scanner app themselves and to be thinking about what they're eating while they're out and about. You know, where they're buying things from the shop, could they be scanning it and having a look? Because sometimes just having that little nudge can help. It's not you nagging them, it can be the app giving them information. You will find that some teenagers are recommended to have braces. It can straighten and improve the look of your teeth, but an orthodontist will only put braces onto teeth that are decay-free. So if you've got any signs of tooth decay, they won't do it because it means that you're not going to be very good at looking after the braces. And obviously the braces are in the way of doing really, good cleaning. So if you've got teeth that have got tooth decay on already, they won't be stable and you're more likely to get more tooth decay. So they just won't do it. Really, really important, cleaning when you're wearing braces. So the cleaning, the mouth washing, the flossing, all of that, really, really important that keep it very, very clean because that brace is going to be on your teeth for 1 to 2 years. You don't want them to come off and be lovely and straight, but brown and with, little bits of decay. So we don't want that. Mouth guards are a really good idea if teens are playing lots of sport. It avoids trauma and injury to the mouth and the teeth. Lots of schools recommend them as well. Other things that teenagers might think are a good idea around the mouth, there would be tooth jewelry, so having things put onto their teeth, mouth piercing, tattoos, dental cosmetic treatments. They've all got risks to your current oral health and your future oral health. So do your research. If your teen is asking for something like this, do your research. There's a great website which I've signposted here called Safe Smiles, and it has all those sort of things and what the knock-on effects could be. Lifestyle choices. Smoking cigarettes, we know that the rates of smoking in teenagers is coming down and down and down, which is fantastic. It carries huge health complications and huge health risks. But in terms of the teeth, tooth staining, bad breath can lead and cause gum disease and tooth loss, and obviously more seriously, mouth cancer. Alcohol can increase the risk of tooth decay and erosion due to the sugar and acid content, so depending on what kind of alcohol they're choosing to drink. And it's also a contributing factor to mouth cancer. If a child is doing both, if an adult is doing both, they are twice as likely, that really increases their risk of mouth cancer. And again, it's a habit, isn't it? It's a bit like brushing your teeth, you want to do it every day. Smoking and drinking are habits which have an addictive quality in there as well. So then it's very hard to stop. So thinking about breaking those sort of unhealthy routines and habits early on is a good idea. Vaping is a great tool for quitting smoking. So it's there, it's got a really great cessation effect, but it contains nicotine, and there are ones out there on the market, I'm sure you'll have seen these, that are disposable, so not great for the planet. but they look cute and they look cool. They're all over TikTok and places like that, and really being promoted to teens. The flavors are sweet flavors, and they're designed to hook your teens onto vaping with nicotine. Now, obviously, it carries less risk than smoking, which is great. But some children and teenagers are doing these vapes at such a high rate, using through them quite quickly, that the effect on the mouth is quite detrimental. So it has a very drying effect inside the mouth and can cause gum disease and tooth decay quite quickly. So again, having those conversations about how you're vaping, what kind are you using, how much nicotine is in there, and obviously teens shouldn't be doing this anyway, so that but they are being targeted via social media to start vaping, even though perhaps they weren't a smoker. So something to have a conversation and be knowledgeable about. Obviously, we know as well that disordered eating and mental health issues can lead to higher risks of erosion, decay, and gum disease. So if you have a teen living with disordered eating or any mental health issues, their oral health may slip as a result. Recreational drugs can lead to a range of health problems. Smoking cannabis can have the same effect as smoking tobacco. Other drugs can cause dry mouth, increase the risk of erosion and decay, gum disease, and bad breath. Some of them will also cause you to grind your teeth, which can cause headaches and other problems as well. And many drugs cause a craving for sugar. So once the initial high has come down, you get cravings for sugar, so sweets, fizzy drinks, etc. will then exacerbate the dry mouth effect with some sugar and acid, and you're going to be way more at risk of tooth decay and problems inside the mouth. So things that can support you with helping your child, your teenager, or supporting your baby with their oral health, their first steps to oral health, is our website. We have lots of leaflets there. We've got 3 designed for children, 3 designed for adults, but we've got a wealth of information, videos, our own YouTube channel, things you can download. So all sorts of things there. So please do head to communitydentalservices.co.uk, and you can find lots of helpful information and things that you can do with your children as well. If you are someone who finds reading information a little bit tricky, or if you've got English as an additional language, we have got this feature on our website as well. So if you're thinking, oh, I'd love to read one of those leaflets, but not sure if I would be able to, then you could ask the little orange guy here to read it for you. It will read it in English. It will also read it in over 100 different languages and read the information to you. So that can be quite useful as well. Okay, I have completely finished, which is really good. I'm going to stop sharing. I hope that the information I've given you has been useful. Granted, it was quite a lot of information, so please do, use the video to skip through and take bits that you need for the relevant age range of the children that you have in your family. And if you have any further questions or would like further information directly from our service in Oxfordshire, please do head to the Community Dental Services website, find Oxfordshire, you can find me, you can contact me directly, and I'd only be too happy to help. Thanks very much for your time. Take care, and take care of your oral health. Bye.